most funny thing is that there will be a kind of competition. Some people will say, okay, let's go to Babalawo, let's go to Pastor. So, but if you have those life-saving skills, you can save the day, and that will make you to become a hero. Just imagine in workplaces or something like schools, somebody can just decide to kind of swim, and the person will just drown there. So if nobody goes in there to help the person, what happens? The person will just go, and if somebody that doesn't acquire those skills decide to dive in, we have to 2 or 3 bodies. So it's very important that you just do everything humanly possible, acquire them, like that of CPR, cardiopulmonary resuscitation, whereby the heart fails or maybe the person is not breathing very well. What you just need to do is to start a manual pumping of the heart, making the heart to manually pump blood and giving the person what we call the breath of life to make sure oxygen circulation still continues in the system. There are different kinds of first aid that will be required. Like if you're talking about somebody slumping now, it's a first aid that you need to administer to the person by practicing what we call CPR or making use of automatic external defibrillator. Or when somebody is choking, you will need to perform what we call Heimlich maneuver to be able to remove that substance or something that is blocking the airway for the person to be able to start breathing normally again. If somebody is injured, then let's say it's a sprain. Somebody hits his head somewhere, the person will definitely require something like a cold compress because there is a sprain. So you need to require cold compress. That cold compress will help to reduce the inflammation. And you now need to kind of apply something like a bandage to make sure that there is no space for those fluid that will cause the swelling to accumulate. So if you're packing your first aid box, if you're into sports, there are kinds of first aid that will be required. If you're into an area that somebody can have a severe cut, or there could be a scorpion sting or snake bite, there are things that should be there, like a tourniquet. Like a tourniquet, if there is no tourniquet available, you can make use of stockings or make use of tie, and make sure you tie the proximal portion of where the injury takes place so that you will stop the bleeding, so that it won't get to the heart. So that's the essence of applying tourniquet. So first aid is very, very important in every home. When building a house, if you are looking for a house, you must look for fire exits. Very important. So there are some fireproof blankets that people can keep in the house. So once there is fire, if you wear it, you can pass through fire and nothing will happen to you. So you require that skill to know how to escape. If everybody can have that in the house, that can seriously help.
Although social media as a channel of communication is inherently harmless, it becomes harmful and damaging when used without discretion and thoughtfulness. Bad social media users spread rumors and fake news without verification. But good social media users stop, reflect, and verify information before sharing it. Be a good social media user. Stop the spread of fake news. Verify the authenticity of your source and use social media responsibly for a better Nigeria. This message is brought to you by the Nigerian Television Authority, NTA, in collaboration with the National Orientation Agency.
This is the network service of the NTA.
welcome to Mother Care. Always a pleasure and privilege bringing the show to you every single week. My name is Marian, and I'm so glad you kept the faith and you've tuned into the show. Today's episode is quite interesting. For me, bittersweet memories because, well, it affected me personally, but I really would love to get more education. We always start with a feature documentary to introduce you to our topic. So when the doctor comes into the house, you'll understand. It's Mother Care. Stay with us.
Sickle cell is a genetic, chronic, long-lived blood disease with severe short and long-term complications leading to anemia and organ damage. This disease is not a respecter of persons, but is most prevalent among persons of African descent, and as such, it is an issue of national and global concerns. It is estimated that about 4.2 million Nigerians are sufferers of sickle cell disease. The most common symptoms are pain and problems from anemia, which can make one feel tired or weak. In addition, one might have shortness of breath, dizziness, headache, or cold in the hands and feet. A blood test can show if one has the trait or is anemic. In conclusion, when it comes to this chronic condition, treatments have helped to relieve symptoms and lessen complications. Researchers are investigating new treatments such as blood and marrow stem cell transplants, gene therapy, and new medicines. Nevertheless, a diagnosis of sickle cell disease doesn't have to mean a miserable, shallow, and brief existence in a cruel world, as there is a light at the end of the tunnel after all, for those who dare to believe.
Welcome back. It's still Mother Care, and that's our feature documentary. Now you understand what we're talking about today. It's sickle cell disorder. Now, if you were a mom out there and you had a child that had this, how would you cope? What kind of challenges are moms facing when it comes to sickle cell disorder? We went to the streets and we found out what real moms had to say about this very real issue.
Sickle cell anemia, to the best of my knowledge, is a blood-related disease or sickness whereby a couple of AS marry themselves.
As far as I know, sickle cell anemia is not good because it keeps not only the child uncomfortable, but the parents too. So I advise couples and men or women, before they get into courtship, it's important they know the sex of the man they are getting married to.
Protect every day with Hypo. Dirty and stains, no fi do a shakara. We got the remedy, original palasa. Hypo, go hypo. Protect your home every day with Hypo.
No gree. Protect every day with Hypo.
Hypo, go hypo.
Alright everyone, no pull your ears, make we talk. Shots my teeth fresh now, but you know, I beg no be slow. Ever had a Colgate, the #1 oral care brand in the world. For zero cavities and long-lasting fresh breath. Mom, it's your time to brush. Mama and Papa buy up, use up and shine your smile. No more cover mouth. Because with Colgate, that's what with your smile.
Protect every day with Hypo.
Germs always find a way back.
So disinfect your kitchen every day with Hypo.
Hypo, go hypo. Protect your home every day with Hypo.
No gree. Protect every day with Hypo.
Hypo, go hypo.
Welcome back. It's still Mother Care. So today we're talking about sickle cell disorder. Now this for me is I don't know. I'm looking forward to the education, but it brings up memories because there was someone I was so close to, and you know how you feel like it's all over. They've passed that stage. She was like a big sister and a mentor to me, and she was already like 45. And well, people told me then that if you pass 40, maybe I get educated today. You know, you had crossed the whole danger zone. And it was just a shock to lose her. So honestly, today I'm trying to smile, but it just brings memories that is so sad. But I'm willing to be educated and inspired by my guest. I'll start with Dr. Aki Odubiton, who is a medical literacy expert. Now, he's a doctor. but he's also someone who educates people on all the big medical jargon we hear every day. It's a great pleasure to have you on the show, Doctor.
Thank you very much.
And then I have Maureen Wachi. She is a sickle cell advocate and a survivor. I start with advocate because she's passionate about this. I don't want to attack her, just a survivor. She's so much more than that. Maureen, it's a pleasure to have you on the show.
I'm happy to be here.
Okay, let me start with, I don't even know who to start with. Let me start with Dr. Aki first. Sickle cell. Now, growing up, I was in a boarding school where, first of all, Maureen, so I pass you on the street. I'm not going to think like you are in this situation at all, because the idea and the picture we have in our minds about sickle cell survivors or people that have the disorder is like they're sickly all the time, they're sad all the time. And then I meet her this today and I'm like,
and she's glowing.
She's glowing. I'm like, okay, we don't tell, I always say, okay, a lady doesn't tell her age, but let me just tell you one thing, she's not as young as you think. She looks like she's 21, add like a lot more and she's that, okay, but you look so amazing. So that's the first I'm going to say, that you just put a smile on my face that this is not the end, definitely. Well, let me start with Dr. Akin. Explain first, because that's what you're good at, explaining the whole jargon. This issue of sickle cell, what exactly, for those who don't understand what's sickle cell disorder?
Okay, so two things. First of all is that the appearance, that classical appearance that we mentally associate with people with sickle cell disorder is actually a build-up of many crises they have had in their younger years when their physical development was happening.
Okay.
So the more crisis a baby, a child has, the more likely they are to be in adulthood, to look like a sickle cell patient as it were. Okay. Let's talk about sickle cell disorder for a bit. We all have blood flowing in our veins. Our blood, if you're like me and everyone else here, is red. Now, blood has cells in it. So the blood has red blood cells, white blood cells, and platelets. The red blood cells have the function of carrying oxygen around the body. So when you breathe in and you breathe out, the air that you breathe in has oxygen inside.
Okay.
That oxygen is captured by the red blood cells and supplies energy across and around the body.
Okay.
But in a few people, the red blood cells do not work optimally. They do not work very well.
Okay.
The reason they don't work very well is because there's something in the red blood cells called hemoglobin. In people who have what we call the sickle cell disorder, their hemoglobin is not structured properly. And so, at certain conditions, in certain environments, when exposed to certain things, their red blood cells change in shape into the shape we call the sickle.
Okay.
Yes. So normally a red blood cell is like a plate, like a plate, but like a frisbee. I don't know. Yes. But when people who have sickle cell the gene, think of a gene as an architectural drawing, and then the red blood cell as the building.
Okay.
So if there's a problem with the architectural drawing, there will be a problem with the building. Exactly. So people who have the sickle cell disorder gene have buildings that are not structurally sound. So their red blood cells are not the way it should be. So under certain conditions, the red blood cells sickle. And that can cause a lot of problems. It can cause problems that start from things like anemia to things which is where there's not enough blood in the person's body, because the blood cells that can actually walk when you breathe in and out are fewer in number. And that can cause a lot of things. So sometimes, because they are sickle-shaped, they can go and clog the blood vessels, so that blood supply to a certain part of the body will not be good and optimal. So it causes bone problems, it can cause brain problems, it can cause problems with the amount of blood available and functional, and a whole lot of health things that we generally term under the tag crisis.
I really have to be honest, and this is something I've heard people talk about a lot, but I've never heard it explained like this. It just it kind of changes my opinion of it. It's just like a condition that this is why it is, and then we term crisis. There's so many things under it. I thought it was just one particular thing that happens all the time, and then you see the person, and that's it. Okay, so this is good education today. I want to ask you, because he said something that caught my attention. He says the appearance is also because of the amount of time the crisis has occurred growing up. What has been your... I'm now thinking, okay, you probably didn't have a lot growing up, because I'm thinking, is that why you look and sound like this? Tell me about your experience growing up in the crisis issue.
Well, growing up, I had quite a number of crises. Some even led to blood transfusions and all that. But I think I had better health care.
Okay.
I think I had better health care, visit the hospital often, ate well.
Okay, diet.
Yes, diet does a lot of good. And the enlightenment at that age helped a lot. My parents were enlightened. The doctors were able to help a lot, enlighten them, you know, tell them what to do, what not to do, what to allow me do, what not to allow me do.
Okay.
Things like that. So I think it helped.
In managing
yes.
Now that I'm going to come back to the doctor, because that's quite important. That first of all, you have the knowledge, the education. She talked about what to do and not to do. Because I remember when I was in boarding house, one of our students, you know, in school, in Form 3, Form 4 then, I remember her saying, oh, I couldn't do this, the dust, that. Now you're talking about the conditions. I'm just remembering this girl. And I remember the seniors always thinking, you're so lazy. You're so lazy. You just use this as an excuse. Because I remember then she was like, the dust was affecting her, so she couldn't sweep. She couldn't cut grass because of, you know. So tell me a bit about this management, because this is quite interesting what she said.
Yeah, so there are quite a number of things I want to draw out from what she said. And first is some 5, 6, 7 decades ago, the sickle cell disorder was a death sentence. You know, it had other names. Things like Ogbanje, Abiku, the witches in the village, and what have you. You know, but it was all a result of ignorance. We didn't quite know, we didn't quite understand. But thankfully, medical research, medical understanding, medical literacy has filtered down through the years and has gotten to the people it matters most, which are the parents, particularly in the context of the sickle cell disease. Now, there are many things that could be trigger factors for the different kinds of crisis that a child could have. And amongst it is, you know, frying oils, some kinds of food, actually. Yes. So allergies that then trigger crisis, you know, danda, there's something we call danda. So danda is insect and animal droppings. You know, so people who had pets, for example. So the kind of fur, you know, so as the cats move around, for example, they leave some fur, dogs, they leave some fur, cockroaches that go around the house. So when you sweep, their leavings also a strong trigger factor for quite a number of people with respect to the sickle cell disease. So frying oils, dust, animal danda, cockroach danda, and a lot of these other things tend to be strong trigger factors, which is why parents need to be very aware of the trigger factors, especially for their children. So what then becomes really important is an observant parent.
Okay.
An observant parent is more empowered to help reduce the incidence and frequency of crisis and therefore have better outcomes for their children. Medical outcomes for their children.
That's very interesting. Now, you're one of 3 in your family with the sickle, and you're the youngest. Okay, that's also very, for me,
it's fantastic.
It's just fantastic. I mean, it's amazing to me. Your parents, I think they deserve an award, first of all, for you know, managing all this. But have you felt or experienced discrimination because of this disorder? Anywhere, whether in relationships, in friendships, in workplace, have you experienced it?
Well, not really. Until I started dating in the university, and I was supposed to marry the person, and that was the only time I could feel, people really need to know.
No, okay.
Yes, yes. No, I had to disclose it. He knew from the onset, but when he got to his parents, no, even though they were educated and all that, they still couldn't. No, we won't allow this. I don't think she can get pregnant. I don't think she will live that long. I don't think, a lot of things, and it's really made me aware of how people were unaware about the disorder. Yeah, so that was the first time I was really discriminated against about, when it comes to the disorder.
So what would you like people to know? What would you like, if you had 2-3 points you wanted to pass across, like, this is it, I would like people to be, because you talk about he's from an educated family, so it's not like, oh, it's not an education, but they're still afraid, they still have ideas about it. What is that thing you'd like people to know about this disorder?
I would like people to know that as human beings, it's not really about the disorder. People die every day.
Yes, you could be passing the road and the Okada will just take you away.
Yes, people die every day. So they really need to understand the subject matter. They need to understand the intricacies. They need to be aware. When they are more enlightened, I think there's hope for people out there. And they need to know that the person who is living with sickle cell is not the disorder. You're first a human being.
Okay, that's what the tag. That's not who you are.
Yeah, it's not who you are. You're much more than that.
Much more than that.
Absolutely.
So if only they could give a lot of people a chance. Yes.
Wow. Okay, so I'm going to ask you the last questions. Do you feel limited in any way? Do you feel like, okay, I have all this education, I have all this information, I advocate, but, do you feel any sort of a limitation, be it from you or from society? Do you feel any limitations?
No, because I have come to believe that every limitation has to do with the mind. If you're limited in your mind, then you can't do anything. There are things I've been told not to do, and I ask. My mom used to have a problem. You ask too many questions. Yes, the doctor says don't do this. Why not?
Why not?
I'll try it. As a child, don't swim. Why not? You could get sick. Okay, no, I'll go swimming. I learned how to swim at the age of 7.
Wow.
I always go swimming. It really didn't stop me. I've gone mountaineering twice.
Whoa.
Yeah.
Wow.
So
okay, I'm ashamed of myself right now.
So I don't really see. If I tell myself I can do it, then I'll do it.
Oh, you are so amazing. I started the show really feeling down about the whole topic because it was personal to me, but I have a smile on my face meeting someone like you, because it just makes it a whole lot better. Thank you so much, Maureen, for sharing your story. I'm so happy to meet you.
Absolutely.
Thank you, Dr. Aki. Thank you, because I
pleasure.
now understand what it means to be a medical literacy expert, because you break it down to the barest minimum and everybody can understand. It was a pleasure talking with you.
Absolute pleasure. Thank you.
Okay, so we're going to take a short break. I don't know why I'm not smiling. I'm trying to put the smile back, like, be normal, but I just feel very happy. I feel like there's so much more to life than what we assume. And she's a living testimony. Say hi to your other siblings, okay? I know she has one who is married with kids.
Yes, married with 4 kids.
4 kids.
He's going on 43.
Can you imagine? And you have a 41-year-old too?
Yes.
Wow. Okay, so and look, I don't even know what you men are doing out there. Okay, but that's dating for another day. Come to my site, dating.com, and I'll give you details. Okay, we'll take a short break. When we come back, I've got our Doc and Coy's Moments with Doctors for all of you who've been sending all your questions. It's just a very short break, and then we'll answer all of them. It's still Mother Care. Stay with us.
Protect every day with Hypo.
Germs always find a way back.
So disinfect your living room every day with Hypo.
Hypo, go Hypo. Protect your home every day with Hypo.
No gree. Protect every day with Hypo.
Alright everyone, no put your ears, make we talk. Shout my teeth fresh now, but I beg no be slow. Ever heard of Colgate, the #1 oral care brand?
always look forward to having my moment with you, and I know you do the same. And this very episode is full of very insightful questions, and I know our advice that we always give to you have been helping. That's why we still get these questions every week for our program. Now, listen to this very first question. Doctor, I have 2 operations to deliver my 2 babies. Now I am pregnant again, and I want to push the baby. What do I do? You cannot push the baby because you have had 2 cesarean sections. You cannot push the baby. Why would you not push the baby? Because if you try to do that, you may rupture your uterus. And when you rupture your uterus, you would lose the baby, you would lose your life. Because no doctor would want you to push after 2 surgeries. So you are likely to go to somewhere where they will allow you, and when complications arise, they cannot handle it. So please, do not ask to push the baby. Go to your hospital and they will get the baby out of you. You'll be happy, you'll be alive, and your baby will be fine. So that is our advice from Mother Care. That is our advice from Moment with Doctor. Doctor, my baby boy is now 4 years old and my wife is not getting pregnant. What can we do? Go to the hospital. If you want to get pregnant again, if there are any issues, go to the hospital. They will check your husband, they will check you, you'll find out why you are not getting pregnant. Please, I want to know if I can get any supplement to use for my son with sickle cell. Yeah, well, I do not exactly know what you mean by supplement. And I know by now the doctors are already managing your son's condition. So why not discuss with them? Why not discuss your concern with them? Why not tell them what you want to give to him? Remember that it's not just all drugs you give to a sickle cell patient. We don't want to drive them into crisis. We don't want to overlabor their liver or their spleen. So we want to be mindful of the kind of things we want to give to sickle cell patients. If there's no need for the supplement, if your doctor have not said he needs that supplement, so why ask him for it? So, but it's good you ask. And we're also advising you that if you have any concern or of anything you wish to give to your child who has sickle cell, please be very free to consult your health professionals who will advise you accordingly. I hope you had a good time, and it's time to sign off. Hope to see you in another episode.
Stains and dirt don't go on break.
So whiten your whites with Hypo.
Hypo, hypo, go hypo. Protect your home every day with hypo.
No green. Protect every day with Hypo.
Hypo, go hypo.
Alright everyone, no put your ears, make we talk. Shout my teeth fresh now, but you know, I beg no be so. Ever had a Colgate, the #1 oral care brand in the world? For 0 cavities and long-lasting fresh breath. Mom, it's your time to brush. Mama and Papa buy up, use up and shine your smile. No more cover mouth. Because with Colgate, that's what do ya down with your smile.
And that's been the show today. I do hope you had enough information and education on sickle cell disorder on the show today, because I learned so much. And I still have a smile on my face because, our guest, Maureen, she's just an amazing young woman. I see a future of limitless possibilities for her. So if you're out there, you need some clarification or more information on this topic, or anything at all, please send us a mail, tweet at us. All our information are on the screen right now. We'd love to hear from you. For all those who had questions on Moments with the Doctor, thank you for sending it in. If we haven't gotten to your question, not to worry. Next week, we will definitely get to your question. And that means next week I'll be back on the same station, same time. My name is Marian. To all the moms out there, being a mom, best job in the world. Thanks for watching.
Emergency! Mayday simply means tribulation!
Any question?
With time, we face time. Then we now put Rodo in his mouth.
Get me a mala with plenty meat. The way I like it. Assorted though.
Long before the beam of satellites, the variety